Hello students, today we'll be discussing about the axilla and the brachial plexus. This is Dr. Yusuf Khan signing from Ajoof University, Saudi Arabia. These are the two specific objectives which we will try to cover in this lecture. The first one is name the boundaries and enumerate the contents of the axilla. And the second one will be describe the brachial plexus regarding its formation, relations, branches, distributions, and injuries related to it. So these are the two objectives we will try to cover. So to begin with, this is the site which is called as the axilla. This is the area between the arm and the chest wall, lateral thoracic wall. So the axilla, the other name for axilla is the armpit. In general, it is called as armpit. The medical term is the axilla. So it is a pyramidal shaped space between the arm and the lateral thoracic wall. So if you can see here in this green area which has been shown here, this is called as the axilla. This is the space between the arm and the lateral thoracic wall. So this space here which will give passage for very important structures from the neck into the arm. This is will be the axilla. This is the axilla here. So what are the boundaries of this axilla? So it looks like a pyramid. As I said before, it is pyramidal shape. So it has a pyramid. When it is a pyramid, it will have an apex, a base, and the walls. So the apex is directed toward the root of the neck. So here it is present, and it is directed toward the root of the neck, and the base is here, which is covered by a thin layer of skin, superficial fascia, and the fascia. So here is the apex, and here is the base, and the four walls: the anterior wall, the posterior wall, medial wall, as well as the lateral wall. We'll discuss this one by one. To begin with, the apex is here. As I said, it is also called as the cervico-axillary canal because it gives passage for the cervical nerves as well as the axillary artery. So that's why it is also called as the cervico-axillary canal. If you see, usually the apex should be sharp, but here it is truncated, it is blunt. It is not sharp as it should be, but it is blunt, and this gives opening for the important structures which pass through this axilla. So it is truncated and directed upwards and medial to the root of the neck. Here is the neck, and it is directed towards the medially towards the root of the neck, and bounded in the front by the clavicle. If you can see here, in the front it is bound by the clavicle, and behind by the superior border of the scapula. Here will be deep inside will be the scapula. So anteriorly we have the clavicle, posteriorly we have the superior border of the scapula, and medially by outer border of the first rib. If you can see in this picture, this is the first rib has been shown. So the outer border of the first rib will form the medial wall. So anteriorly we have the clavicle, posteriorly we have the upper border of the scapula, and medially we have the first rib. So this is the apex of the axilla. The base as I said is also called as the floor, and it is covered by the skin, superficial fascia, as well as the deep fascia, which is also called as the axillary fascia. What you see here in this part, this skin here, so this area, this whole area will form the base, which is covered by the skin, the superficial fascia, and the deep fascia, which is also called as the axillary fascia. The anterior wall, here will be the anterior wall. It has been removed here so that you can see the deeper structures. So this is formed by then the superficial fascia, the skin, superficial fascia, deep fascia. Deep inside we have two important muscles, which are the muscles of the pectoral region, that is the pectoralis major as well as the pectoralis minor. This will form the anterior wall, along with a small muscle here just below the clavicle, which is called as the subclavius. All these three structures will be present in the anterior chest wall, which will form the anterior wall for this axilla. Posteriorly, we have the muscles of the scapular region, that is the subscapularis, latissimus dorsi, as well as the teres major, which will form the posterior wall. So anteriorly we have the muscles of the pectoral region, posteriorly we have the muscles of the scapular region. Medially, as I said, there is the ribs, the lateral wall of the ribs. The upper 4 to 5 ribs will form the medial wall. Along with the ribs here, the bones which are the ribs here, along with them, there are some structures in between these ribs. These are called as the intercostal structures, especially the intercostal muscles will be present here. So these are the ribs here. This is the first rib, this is the second rib, third rib, fourth rib, and fifth rib. And in between we have the intercostal muscles. Inter means in between, costa means the ribs. So intercostal muscles, the muscles which are between the two, between the two ribs will be called as the intercostal muscles. So there will be 3 layers of this muscle, the intercostal muscles. So this will be forming the medial wall. The ribs, the upper 4 to 5 ribs, as well as the intercostal muscles which are in between them, as well as in the lower part, on the lower part, as well as in the side, we can also see the serratus anterior. This is the muscle which is called as the serratus anterior, which also form the medial wall of this axilla. Coming laterally it is mainly the bone here. This is the humerus, shaft of the humerus, along with the muscles here, that is the biceps brachii. Here you can see this is the biceps brachii. This is the long head of the biceps brachii here, and this is the short head of the biceps brachii, as well as the coracobrachialis. There is a small muscle here which is called as the coracobrachialis. So this will be, so deep inside here you can see the coracobrachialis muscle. So these are the 3 structures which will be forming the lateral wall. One is the humerus itself, then we have the long head of biceps, as well as the short head here. Along with that, there is a small muscle here on the side. This will be called as the coracobrachialis. All these structures will be forming the lateral wall. So we have the apex here, the base or floor is here, the anterior wall formed by the pectoral muscles, posterior wall formed by the muscles of the scapular region, medial wall formed by the ribs as well as the intercostal muscles, and lateral wall formed by the humerus as well as the biceps brachii as well as the coracobrachialis. So these are the walls, the base as well as the apex of this triangular structure, which is called as the axilla. Okay, now we should know why we study the axilla in so much detail. What is the importance? The importance is because of its contents. There are very important contents within the axilla, and we are supposed to know them. So that's why we study the axilla. One of the very important content is the axillary artery. If you can see here, this is the subclavian artery, which is containing below as the axillary artery. So the subclavian artery on the left side is a direct branch from the arch of the aorta, and on the right side it is a branch from the brachiocephalic artery, which is a branch from the arch of aorta. So on the left side it is directly from the arch of aorta, and on the right side it is the branch of brachiocephalic trunk, which is a branch which is coming from the arch of aorta. So this is the subclavian artery, which continues as the axillary artery when it enters into the axilla. So that's what is called as the axillary artery, and this is the one of the most important artery which is supplying the upper limb. So this is the most important artery which is supplying the upper limb. That's why this artery is very important. So the most important content here is the axillary artery and its branches, which will be supplying the whole of the upper limb. Along with that, there is the axillary vein, which is the main vein which will be draining the whole of the upper limb. So this is the axillary vein which continues as the subclavian vein. So this axillary vein and its tributaries will be draining the whole of the upper limb. So this is the second important content. The third and the most important content is the cords of the brachial plexus. There are plexus of nerves which are coming from the neck, from the spinal cord, and this plexus of nerves will be supplying the whole of the upper limb. So this plexus is called as the brachial plexus, and we'll study this in detail after some time. So that's why this is one of the important content along with the axillary artery and the vein. So this is the plexus of nerves which is called as the brachial plexus, which will supply the whole of the upper limb. Along with that, there are some group of lymph nodes which will be draining the pectoral region, the mammary gland and other structures in the pectoral region. And this is a very important area where if there is carcinoma of the breast or something like that, at that time it will be draining into the axilla. So this axillary group of lymph nodes, again there are subdivisions within the axillary group of lymph nodes that we will study later. So this axillary group of lymph nodes are also very important. Along with that, because there are important structures, so these structures have to be protected, so there is a thick pad of fat, this is called as the axillary fat, and as well as the axillary tail of spine. So this is nothing but the elongation of the breast mammary gland itself, which will be entering into the axilla. This is called as the axillary tail of spines. Okay, so these are some of the important contents. One is the axillary artery and its branches, axillary vein and its tributaries, the cords of the brachial plexus and their branches, the axillary lymph nodes, as well as the axillary fat, as well as the axillary tail of spines, which is an extension from the mammary gland. So these are some of the important contents of the axilla. Now we'll try to understand the brachial plexus, which is the most important structure, which is a plexus of nerves which will be supplying the upper limb. So here you can see here, so these are the plexus of nerves which are coming from the spinal cord, and they'll be going into passing through the axilla and going through the axilla and supply the whole of the upper limb. So this plexus of nerves are called as the brachial plexus. It is a plexus of nerves which will supply the upper limb. Formation: it is the union of ventral primary rami or anterior primary rami of the lower four cervical nerves, that is C5, C6, C7, C8, and the greater part of the first thoracic rami, that is the T1 nerve roots, with variable contribution from C4 and T2. So what do you mean by this? So it is nothing but the union of ventral or anterior primary rami of the lower four cervical nerves. Lower four cervical nerves are C5, C6, C7, C8. Upper four will be C1, C2, C3, C4, and the lower four of the cervical nerves are C5, C6, C7, C8, which are coming from the spinal cord, and there is also contribution from T1. So this is the root value of the brachial plexus: C5, C6, C7, C8 and T1. Whenever they will ask you the root values, so you should be able to tell it is the root value of the brachial plexus is C5, C6, C7, C8 and T1. So here they have mentioned ventral or anterior primary rami. So what does it mean? So this is the spinal cord here. So if you see this picture here, this is the spinal cord, and the cervical nerves which will be forming the brachial plexus are coming from here: C5, C6, C7, C8, and also the upper thoracic T1. So this will form the brachial plexus. The above are the C1, C2, C3 and C4. So below this will form the C5, C6, C7, C8 and T1 nerve roots will be forming the brachial plexus, and you can see an enlargement here because of this plexus. This is called as the cervical enlargement of the spinal cord. Similarly, here there are some nerves which will be coming from the lumbar part, and they will be supplying the lower limb, and that will be called as there will be again a thickening here in the lower part of the lumbar part, and that will be called as the lumbar enlargement, which is supplying the lower limb, that is called as the the lumbosacral plexus, which will be supplying the lower limb. So here will be an enlargement that will be called as the lumbar enlargement. Here, because it is in the cervical region, this is called as the cervical enlargement, and this will be this the nerve roots which are coming. So here, so these are the dermatomes which will be supplying the upper limb. So C5, C6, C7, C8 and T1. So this is the skin part, which will be, these are called as dermatomes, which are the area supplied by one single nerve on the skin. Okay, so here if you see here, this is the spinal cord, these are the coverings of the spinal cord, and this is how the nerve roots will be coming. So here, to be more specific, this is the cross section of the same spinal cord. Here this is the vertebra here, and here this is the spinal cord, and you can see here the nerves are coming out. Okay, so these are the roots. So here the anterior one, this is called as the anterior root, and this is the behind, this is called as the posterior root. How do you identify the posterior root? Here you can see a ganglion here. This is the ganglion which will be present in the posterior root. So this is the anterior root and this is the posterior root. These two roots will join together to form a single spinal nerve, and when they come out, they will be forming an anterior rami and the posterior ramus. Ramus is singular and rami are the plural. Okay, so this is the anterior ramus and the posterior ramus. So this is one single spinal nerve which is formed by the two anterior and posterior root, and here you can see the spinal nerve, and this spinal nerve, when it comes out, this will be divided into anterior rami and posterior rami. Now what we are discussing is the anterior primary rami will be supplying the upper limb. The posterior rami usually they supply the posterior part or the back. Okay, usually the posterior. This is also called as the dorsal, and dorsal means posterior, and this anterior ramus will be called as the ventral ramus. So this is what we are talking here. So it is formed by the, so here you can see here, it is the brachial plexus formed by the anterior primary rami. So this we have seen the picture where we have the anterior primary rami, or it is also called as the ventral primary rami of the lower four cervical nerves C5, C6, C7, C8, as well as the contribution from the T1, also ventral rami of the T1 upper thoracic nerve. So as I said, this will be the area of the skin supplied by the same root value C5, C6, C7, C8 and T1, and this each area supplied by one single nerve is called as dermatome, and this is the supply of the skin. For the deep inside, for the muscles, it will be totally different. Now we'll try to study the brachial plexus in detail. So as we said already, it is the contribution from the anterior primary rami of the, so you have seen this, the anterior primary rami or the ventral primary rami of the nerve roots from C5, C6, C7, C8 and the T1. Sometimes in some cases this contribution from these nerves can slightly vary. It can shift one step above or step below. Okay, so it might shift one segment upwards or downwards and give rise to something called as the prefixed or the postfixed type of plexuses. What do you mean by this? The prefixed plexus is where there will be contribution from C4. Instead of starting from C5, C6, C7, C8, it will start from C4. Then there will be contribution from C5, C6, C7 and C8, and there will be might be or there might not be contribution from T1, or there might be very much reduced contribution from T1. So this has shifted one step above, so one segment above. This is called as the prefix plexus, where the contribution, instead of starting from C5, it will start from the C4, C5, C6, C7 and C8. Similarly, sometimes it can be one step below, one segment below. So this is called as the postfix plexus. So what does it mean? So in this case, there will be contribution from C6, C7, C8, T1, as well as some contribution even from the T2. So instead of there might be no contribution from C5 or very less contribution from the C5. Okay, so the main rootlets which are coming will be from C6, C7, C8, T1 as well as T2. This is called the post fixed plexuses. So this variation you should keep in mind, because sometime there might be some variation, either it might be prefix or post fixed. So but usually it will be the contribution from C5, C6, C7, C8 and T1 nerve roots. This plexus, as you have seen, it originates in the neck. You have already seen it is coming from the spinal cord, and here they are coming out into the neck, and they will pass through the axilla. They will transverse laterally and inferiorly over the first rib. Here you can see here the first rib, and enters the axilla. So the nerve roots are coming from here, and they will pass into the apex of the axilla, lateral to the first rib, and enter the axilla. Here in the axilla, this brachial plexus will be divided into roots, trunks, divisions, cords and branches. We'll try to study this in detail. Try to concentrate on these different parts of the brachial plexus: the roots, trunks, division, cords and the branches. So you have seen these are the roots, which are the formed by the anterior rami, okay, or it is also called the ventral rami. These are called as the roots, okay. So here you can see here these are the roots which are coming here from C5, C6, C7, C8, okay. So the roots from C5 and C6 join to form the upper trunk. So here you can see here the roots. So they have been shown here in the picture. These are the roots which are coming from the spinal cord outside, and when they come out, be in the form of roots. So these roots, the C5 root and the C6 root, will join together to form the upper trunk. Anterior rami of the C5 and C6 will join together to form the upper trunk. Okay, so there is the trunk here. The C7 will continue itself, the root itself continues as the middle trunk. So it will not join or divide, but it will continue, the root itself continues as the middle trunk. And the C8 and T1 will join to form the lower trunk. So there are three trunks here after the roots. So these are the roots. Roots are from C5, C6, C7, C8 and T1. So the C5 and C6 roots will join to form the upper trunk. C7 root will continue as the middle trunk. C8 and T1 continue as the lower trunk. So did you follow till here? Okay. So now see the trunk. So now there are three trunks: the upper trunk, the middle trunk and the lower trunk, or it is also called as the superior trunk, middle trunk as well as the inferior trunk. So there are three trunks now. Now the trunks will divide into a ventral as well as the dorsal division. So these trunks will divide now into ventral and dorsal. As I said, ventral means anterior, dorsal means posterior. So they will divide into that part which will supply the anterior part of the upper limb and the posterior part of the upper limb. So all these three trunks will divide into ventral and dorsal division, and they will supplying the anterior and posterior aspect of the upper limb. And this division of the trunks into anterior and posterior, or the ventral and dorsal division, will be usually behind the clavicle. Clavicle has been removed here. If not, it will be present here. Okay, just behind the clavicle will be trunks will be divided into the ventral and dorsal division. Now you can see here in this picture, again I am repeating here so that you can understand. The roots we have already seen: the anterior primary rami, the C5 and C6 will join to form the upper trunk or the superior trunk. C7 root will continue as the middle trunk, and the C8 and T1 roots will join to form the inferior trunk or the lower trunk. So there are three trunks: superior trunk, middle trunk and the inferior trunk. There are 5 roots, but when they join, C5 and C6 join to form the superior, C7 continues the middle, and C8 and T1 will join to form the inferior. Now these three roots will divide into again two divisions: anterior and posterior, or ventral and dorsal divisions. Okay, so here you can see the superior trunk will divide into the anterior and posterior division, or it is also called as the ventral and dorsal division. Okay, so the division here of the upper trunk as into anterior or ventral division, and the ventral division of the middle trunk will join to form something called as the cords. This is called as the lateral cord. So the anterior division of the superior and the middle trunk will join to form the lateral cord. Okay, the posterior division of all the three trunks, superior, middle as well as inferior division, will join to form the posterior cord. The anterior division of the inferior trunk will continue as the medial cord. So there are three cords now. There were 5 roots which joined together to form superior, middle and inferior trunk. All these three trunks divided into anterior and posterior division or ventral and dorsal division. The posterior division of all the three will join to form the posterior cord. The anterior division of the superior and middle trunk will join to form the lateral cord. The anterior division of the inferior trunk will continue as the medial cord. So there are three cords now: lateral cord, posterior cord and medial cord. Why they are called as lateral, posterior, medial? Because they are in relation to the middle second part of the axillary artery. If you imagine, there will be an artery here. This is called as the axillary artery, which is lateral to that. That will be lateral, means away from the body. That will be called a lateral cord, which is towards this center of the body. That will be called as medial. So it is medial to the artery, and this will be posterior to the artery. If you see now the picture, then you will appreciate it. So here you can see here the subclavian artery coming, and it contains as the axillary artery. So the second part of the axillary artery will be here, and here you can see the three divisions. Okay, so the divisions will be there, and now the divisions are joined to form the cords. So here this is the lateral cord, which is lateral to the artery. Now here you can see the posterior the medial cord, which is medial to the artery, and you can see here behind, which is posterior to the second part of the artery. This is called as the posterior cord. So there are three cords: lateral cord, which is lateral to the second part of the axillary artery; medial cord, which is medial to the second part of the axillary artery; and the posterior cord, which is posterior to the second part of the artery. So how these cords are formed? The lateral cord is formed by the union of the ventral division or the anterior division of the upper trunk as well as the middle trunk. The medial cord is the continuation of the anterior division of the inferior trunk. So the inferior trunk continue as the medial cord. So the medial cord is formed by the ventral division or the anterior division of the lower trunk or the inferior trunk. The posterior cord, as the name indicates, posterior cord is formed by the posterior division or the dorsal divisions of all the three trunks. The upper trunk, middle trunk and the inferior trunk, all the posterior divisions of all the three trunks will join to form the posterior cords. So as I said, these are called a lateral, medial and posterior in relation to the second part of the axillary artery. So here you can see here this is the second part of the axillary artery. And these are the relations of these three cords: lateral cord, medial cord and the posterior cord. Now again you can see here these are roots C5, C6, C7, C8 and T1, which are the roots. The C5 and C6 join to form the upper trunk, superior trunk. The C7 continues as the middle trunk, and the C8 and T1 join to form the inferior trunk. Now these three trunks divide into anterior and posterior division or the ventral and dorsal division. The anterior division of the superior and middle trunk will join to form the lateral cord. The anterior division of the inferior trunk will continue as the medial cord, and the posterior division of all the three, posterior division or the dorsal division of all the three trunks will join to form the posterior cord. So these are the three cords now. These are the most important: lateral cord, medial cord and the posterior cord. Now from here all the nerves will be coming. So whenever you study the nerve, you should know from which cord it is coming. So this is what you are supposed to remember. So here again this picture has been shown: C5, C6, C7, C8 and T1. I am repeating so that you can understand the things. Okay, C5 and C6 will join to form the upper trunk or the superior trunk. The C7 will contain the middle trunk, C8 and T8 will join to form the inferior trunk. So this three divisions, these with three trunks will divide into divisions, anterior and posterior division. The posterior division of all the three trunks will join to form the posterior cord. So this is the posterior cord here. The anterior division of the superior and middle trunk will join to form the lateral cord, and the anterior division of the lower trunk will continue as the medial cord. So here you can see it. So now these three cords, the superior, the lateral cord, the posterior cord, and the medial cord will give some branches of nerves. So all these will be giving branches from and these nerves are the very important nerves which will supply the whole of the upper limb. So whenever you study any nerve, you should be able to trace to up to the cords. So you should know from which cord, whether it is from the lateral cord, medial cord, or the posterior cord, from where this nerve is coming. Now we'll try to study these branches. Before we study the branches which are coming from the cord, there are some branches even coming from the roots itself. Roots are here, right? So here are the roots here. So there are some nerves which are important, which are coming from the roots themselves. So which are those nerves? One is the nerve to serratus anterior, very important nerve, which is also called as the long thoracic nerve, which is coming from the C5, C6 and C7. They are directly coming from the roots, and it will be supply a muscle here which is called as the serratus anterior, and this nerve is called as the long thoracic nerve. This nerve is also called as the nerve of Bell, because the serratus anterior will be called as the muscle of Bell. This is the muscle which is helpful for the pulling of the bell. In case of the churches, there will be a big bell, and whenever they pull, this is the most important muscle which will be acting. So that's why this is called as the muscle of Bell, and this long thoracic nerve is also called as the nerve of Bell. Okay. So this is the long thoracic nerve which is coming from C5, C6 and C7 roots. Any other nerves coming? Yes, there are other nerves are also coming. There is nerve to the rhomboids, which is also called the dorsal scapular nerve. There is a small nerve here, if you can see, dorsal scapular nerve, so which is coming directly from C5. So it is coming only from the C5. So this is called the nerve to rhomboids. There are muscles in the back which are called as rhomboids major and minor, and these muscles are supplied by this nerve to rhomboids. There are also some nerves which are called as the nerve to scalenus and the longus colli, which are coming from again from C5, C6, C7 and C8. So these are also coming from the roots of the C5, C6, C7 and C8. So these are called as the nerve to scaleni or scalenus anterior and the longus colli. There is also a branch which is a very important nerve which will be supplying the diaphragm. This is called as the branch to the phrenic nerve. There is a nerve which is going here which is called as the phrenic nerve, which is coming from C5, which will be going all the way, and it will be supplying the dome of the So these are some of the branches which are coming from the roots. So nerve to serratus anterior, which is also called as the long thoracic nerve. The nerve to rhomboids, which is also called as the dorsal scapular nerve. Nerves to scaleni as well as the longus colli, which are the muscles in the neck, and the branches to the phrenic nerve. So these are the branches which are coming directly from the roots. They are not from the trunks, they are directly from the roots. There are branches even from the trunk. So after the roots, here are the trunks here, right? So there are branches which are supplying the trunk. It is only from the upper trunk which will be coming. There are no branches from the middle as well as the lower trunk. Only the upper trunk will be giving branches. This is called the suprascapular nerve, which will be supplying the suprascapular area. This is the suprascapular nerve. Now again there is also a nerve which is called the nerve to the subclavius. Subclavius is a small muscle which is just below the clavicle. That's what is called a subclavius, below the clavicle. So there is a small muscle here, this is called a subclavius. So there is, this muscle is also supplied by a nerve which is coming from the upper trunk. So this is the nerve to subclavius. So these are the two muscles which are supplied by these two nerves, suprascapular nerve as well as the nerve to subclavius, which is coming from the C5 C6 roots, because it is coming from the upper trunk, which is formed by the C5 and C6 roots. So only the upper trunk will be giving branches. There are no branches from the middle and the lower trunk. So these are the branches from the roots and branches from the trunk. Now coming to the most important part, that is the branches from the cords. So here you can see again the picture to show you the structures. Here you can see here the roots which are coming here, and from here there are some nerves which are coming. One is the phrenic nerve, which will be going and supply the dome of the diaphragm. Here is the nerve to subclavius, which is coming from the upper trunk, which will be supplying a muscle, small muscle here called as the subclavius. Then there is a nerve which is going to the scapula, that is called as the suprascapular nerve, as well as the dorsal scapular nerve here, which is also coming. And here you can see the long thoracic nerve which is supplying the serratus anterior. So these are coming from the either from the roots or from the trunk. Only the upper trunk will be giving the branches. Now coming to the branches from the cord, the most important nerves which will supply the upper limb will be the branches which are coming from the cords. So which are those branches? So now we have to know what are the branches coming from each cord. So as you know, there are three cords: the lateral cord, medial cord, and the posterior cord. So what are the branches which are coming from the lateral cord? Oh, this is called as the LML. LML. There was a scooter in India which is called the LML Vespa. I think nowadays it is not there. So this is called a LML. This is how you can remember. So so this will be the three branches which are coming from this lateral cord. One is the lateral pectoral nerve. The first L stand for lateral pectoral nerve. The second M stand for the musculocutaneous nerve, and the third one is L, again lateral root of the median nerve. Now try to trace these nerves which are coming. One is this is the lateral cord here, because it is lateral to the second part of the axillary artery. So this is the lateral cord. So the lateral cord will be giving a nerve which will supply the pectoral region. This is the lateral pectoral nerve. Then there will be a nerve which will be coming from this, which will be called as the musculocutaneous nerve. So here is the musculocutaneous nerve which will be supplying the biceps brachii as well as the brachialis. So this is the musculocutaneous nerve. The third is the lateral root of the median nerve. There is a very important nerve which is coming here. This is called as the median nerve. So it is formed by two roots. One is the lateral root and the medial root. Medial root coming from the medial cord, lateral root coming from the lateral cord. So this is the lateral root of the median nerve. So these are the three branches which are coming from the lateral cord. One is the lateral pectoral nerve, which has not been shown here. The second is the musculocutaneous nerve, which is here shown here as the thin nerve which is passing between the biceps as well as the brachialis. And the third nerve is the lateral root of the median nerve. As I said, median nerve is from a lateral root and medial root. Lateral root from the lateral cord, medial root from the medial cord. So these are the three nerves, and the root value C5, C6, C7, because it is from the lateral cord. So there are three nerves which are coming from the lateral cord: LML, lateral cord, lateral pectoral nerve, musculocutaneous nerve, as well as the lateral root of the median nerve. Now coming to the medial cord. Medial cord will be giving 5 branches. Which are those? This stand for MMMUM. So how can you remember this? Most medical men use morphine. This is the synonymous which we use to remember this. Which is the first M stand for? This first M stand for the median pectoral nerve. This is the medial pectoral nerve. The second M stand for medial cutaneous nerve of the arm. The third M stand for the medial cutaneous nerve of forearm. The fourth is U, which is ulnar nerve, and the fifth M stand for medial root of the median nerve. So here you can see in this picture. So this is the medial cord. It will be giving 5 important branches. One, the last one, the medial root of median nerve, which will join from the lateral root of median nerve to form the median nerve itself. So as I said, median nerve will have a contribution from two roots, lateral root and medial root. Lateral root from the lateral cord, medial root from the medial cord. Okay, so this is the first branch. Then we have something called as the medial pectoral nerve. We have seen that the lateral cord will give the lateral pectoral nerve. This medial cord will be giving the medial pectoral nerve. Then we have the medial cutaneous nerve of the arm. There are thin nerves, if you can see here. This is called the medial cutaneous nerve of arm, which will supplying a small part of the arm, skin of the arm. Cutaneous means skin, so it will supplying the skin. These are cutaneous nerve. Okay, the medial cutaneous nerve of arm. Then we have a longer nerve which is also cutaneous. This is called the medial cutaneous nerve of forearm, which it will, because it will be supplying a small part in the forearm, a small part of the skin of the forearm. This is called the medial cutaneous nerve of forearm. Then we have a long thick nerve which will be running down here behind the elbow. So this is called the ulnar nerve, a very important nerve here, which is called the ulnar nerve, which is the nerve of the hand. So this is the ulnar nerve. Then we have the we have already seen the medial root of the median nerve. So these are the 5 branches. One is the medial pectoral nerve, which is supplying the pectoral region. Then we have the medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Then we have the ulnar nerve, and the fifth is the medial branch or the medial root of the median nerve. So here the root values have been shown here. So these are the 5 branches which stand for MMMUM. How can you remember this? Just remember this synonymous. Most medical men use morphine. So here you can see again the picture clearly. So this is the medial cord. This is the medial root of the median nerve. Here you can see here, this is the thick nerve which is called the ulnar nerve. Then you can see a small nerve which is coming here. This is called the medial pectoral nerve. Then we have a thin smaller nerve. This is called the medial cutaneous nerve of arm. Then a thin longer nerve which is called the medial cutaneous forearm. So these are the 5 branches: ulnar nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, and the medial pectoral nerve, and this is the medial root of median nerve, which contributes in the formation of the median nerve itself. So these are some of the 5 branches from the medial cord. Now coming to the posterior cord. Posterior cord also has 5 branches. This can be remembered by with the synonymous term called the ulnar or ultra. So which are those? The first one is the upper subscapular nerve. The upper subscapular nerve. Then the second is the lower subscapular nerve. The third is the nerve to latissimus dorsi, also called as the thoracodorsal nerve. Then we have the axial nerve, very important nerve, as well as the radial nerve. These are very important nerves which are coming from the posterior cord. So here you can see here this the darker yellow colored structures. These are the nerves which are coming from the posterior cord. And because they're coming from the posterior cord, contribution from the dorsal division, so it will be mainly supplying the posterior part of the upper limb. The first nerve is the upper subscapular nerve, and the lower subscapular nerve have not been shown here. These are small nerves which will be supplying the muscles of the scapular region. Then we have the nerve to the latissimus dorsi, also called as the thoracodorsal nerve. Then we have a nerve which winds around the neck of the humerus. This is called as the axial nerve, a very important nerve which will be supplying the especially the deltoid muscle here. And whenever there is injury at this neck of the humerus, then it will damage even the axial nerve. Okay, so this is the axial nerve which winds around the neck of the axilla, or the winds around the neck of the humerus. Then we have a very important nerve which is called the radial nerve, which is mainly supplying the posterior compartment of the arm and the forearm and even the hand. Okay, so this is the important nerves. One is here seeing, this is the radial nerve, then the axial nerve. Then the other nerves are smaller nerves, upper subscapular, lower subscapular, as well as the nerve to the latissimus dorsi. So this can be remembered by the term ulnar or ultra. Okay, so these are the five branches which are from the posterior cord. So the medial cord will give five branches, the posterior cord will give five branches, but the lateral cord gives only three branches. So 5 5 3. So these are the branches which will be supplying the whole of the upper limb. So whenever we read about any nerve, so we should be able to say from which cord it is coming and the root values. Here are the root values which have been shown here, and the biggest root value is for the radial nerve because it is formed by all the divisions of all the three trunks, the posterior division of the three trunks, C5, C6, C7, C8 and T1. Here you can see here, this is picture to show the upper and lower subscapular nerves. Here this is the upper subscapular nerve and this is the lower subscapular nerve. This is the subscapularis muscle which is supplied by two nerves, upper subscapular as well as the inferior or the lower subscapular nerve. Here you can see here, this is the thoracodorsal nerve which is supplying the latissimus dorsi. Then we have the radial nerve as well as the axillary nerve. So all the branches have been shown for the posterior cord. So these are the five branches from the posterior cord: upper subscapular nerve, lower subscapular nerve, the thoracodorsal nerve, axillary nerve as well as the radial nerve. So this radial nerve has been shown here from the posterior side, passing through the radial groove, a very important area through which it passes, and it is more prone for damage at this spot because whenever there is fracture of the shaft of the humerus, this is the nerve which is prone for injury and the complications related to that. So this is the radial nerve passing through the radial groove. Now again, I am repeating it so that you can understand and remember for the final term here. So first, the divisions of the whole of the brachial plex. So it is divided into roots, trunks, divisions, cords and terminal branches. So the roots of the brachial plexus is formed by C5, C6, C7, C8 and T1. So C5 and C6 join the ventral rami. You should remember ventral rami is C5, C6, C7, C8 and T1. So the C5 and C6 roots will join to form the superior trunk. The C7 will continue as the middle trunk. C8 and T1 join to form the inferior trunk. So all these trunks will give anterior and posterior division. The posterior division of all the three, superior, middle and inferior, join to form the posterior cord. The anterior division of the upper and middle trunk will join to form the lateral cord, and the anterior division of the inferior trunk will continue as the medial cord. So they are called as lateral, posterior and medial in relation to the second part of the axillary artery. Now coming to the branches which are coming from these three cords. From the lateral cord there are three branches: lateral pectoral nerve, musculocutaneous nerve as well as the lateral root of the median nerve. So these are three branches from the lateral cord. The medial cord will give five branches: medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Then we have the ulnar nerve and the medial root of the median nerve. This is the lateral root and the median root joined to form the median nerve. So median nerve is formed by the contribution from two cords, lateral cord as well as the medial cord. All others are from each individual cord, but median nerve is from two cords. The posterior division will give five branches. Here you can see the axillary nerve and the radial nerve, the most important nerves. Along with that, there will be upper subscapular, lower subscapular as well as the thoracodorsal nerves. These are the nerves which are coming from the three cords. Now, along from the cords, there are also some branches which are coming directly from the roots of the trunk. So from the root, you can see here in the picture they have shown you the long thoracic nerve, which is also called as the nerve of Bell, supplying the serratus anterior. Then you can see the phrenic nerve contribution to the phrenic nerve as well as dorsal scapular nerve. The upper trunk will give two branches. One is the suprascapular nerve as well as the nerve to the subclavius. That has been shown. Middle and lower trunk don't give any branches. So again, this has been shown here: C5, C6, C7, C8 and T1. So here the C5 and C6 join together to form the upper trunk. C7 continues as the middle trunk. C8 and T1 will join to form the inferior trunk. So there are roots from the directly from the roots. So there are nerves from the roots. So one is the dorsal scapular nerve has been shown here. Then you can see the long thoracic nerve. Then you can see here the upper trunk will give two branches. Only the upper trunk will give branches. One is the nerve to subclavius and the nerve to the suprascapular nerve. So this is about the trunks. The trunks will divide into the anterior and posterior division. The posterior division of all the three trunks, upper, middle and lower trunk, will join to form the posterior cord here. The anterior divisions of upper and middle trunk will join to form the lateral cord, and the anterior division of the lower trunk will continue as the medial cord. So the lateral cord will give three branches: lateral pectoral nerve, musculocutaneous nerve, and the lateral root to the median nerve. The medial cord will give five branches: medial pectoral nerve, medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, the ulnar nerve, as well as the medial root of the median nerve. So this median nerve is formed by the lateral and the medial cords. Now in the dark color they have shown you the posterior cords. One is the radial nerve, this is the axial nerve. Then you can see the upper subscapular, lower subscapular, as well as the thoracodorsal. So these are some of the parts of the brachial plexus, and the divisions, trunks and cords, and the branches from each of them. Now let's discuss about the applied aspects. The first applied aspect for the brachial plexus is called as Erb's paralysis. Erb's paralysis is also called as the policeman's strip hand or potter's strip hand because of the position of the hand. If you can see in this pictures, the infants with the policeman's strip hand, if you can see here, the upper limb is totally medially rotated and the palm is facing backwards. And here in this case it is bilateral in both the upper limbs. So the upper limbs are medially rotated and the palms are facing backwards. So this position is called as the policeman's strip hand, or it is also called as the potter's strip hand. The site of injury is called as Erb's point. What is Erb's point? So if you see, this is the upper trunk which is formed by the C5 and C6 roots. So this upper trunk, in this upper trunk, the point where the six nerves meet, that point is called as the Erb's point. If you see this picture before, so if you can see here, so in the upper trunk, this is the upper trunk formed by C5 and C6. So these are the two roots, C5 and C6. Then this is the superior upper trunk. It divides into anterior and posterior, or ventral and dorsal divisions. Okay, so these two and this two, and upper only trunk which gives branches is the upper trunk. So there are two branches from here. This is called as the suprascapular nerve as well as the nerve to subclavius. So this point where the six nerves C5 C6 roots will meet, and it divides into anterior and posterior division or ventral and dorsal division, and it gives two nerves. One is the suprascapular nerve and the nerve to subclavius. This point here, this is called as the Erb's point. So the injury of the Erb's point leads to this position called as the Erb's paralysis or the policeman's strip hand. So this is the upper trunk here, or superior trunk, and this point here is called as the Erb's point. So how does it happen? Whenever a person falls from on his shoulder, at that time this leads to damage to the upper trunk, and sometimes even during birth injuries, during delivery, when you put the forceps and try to pull the head by unexperienced doctors, at that time there might be some birth injury, and that leads to again this Erb's paralysis. Or sometimes even the anesthesia, when you're giving the anesthesia, if you're not careful at that time, even this Erb's point can be injured, and that leads to this condition called as the policeman's strip hand. So whenever this earth paralysis is there, this is because of the nerve roots involved, which are C5 and partly C6, mainly by the injury to the C5 root as well as partly the C6. And if there is earth paralysis, the muscles involved, the position of this policeman's tip hand is because of the muscles involved. So what are the muscles involved? One is the biceps brachii here, then the deltoid, then the brachialis, brachioradialis, supra, as well as the infraspinatus. All these muscles are supplied by C5 and partly C6, and all these muscles are paralyzed, and that leads to this condition called as the Erb's paralysis or the policeman's tip hand. So here the biceps is involved as well as the deltoid. So the upper limb is totally adducted, and the brachialis is paralyzed as well as the brachioradialis. All this leads to medial rotation of the upper limb as well as supra as well as the infraspinatus. All these muscles are involved in this paralysis called as the Erb's paralysis. It is also called as the policeman's tip hand or Porter's tip hand, and this is because of the Erb's point, which is the point in the upper trunk where the six nerves meet, that is the C5 and C6 roots, then the anterior posterior division, as well as the suprascapular, as well as the nerve to subclavius nerve. All these point where all these nerves meet, that point is called as the Erb's point. And if there is any injury to this point, and this injury is usually because of the fall on the shoulder, or sometimes during the birth injuries, or abnormal the or the anesthesia, when you give the anesthesia, if you don't do it properly at that time, there might be Erb's paralysis. The second type of paralysis is called as the Kumphase paralysis. This deformity which will be leading in this condition will be called as claw hand. If you can see here, this is the claw hand. You can see here, this is the claw hand, just like the hand of the apes and monkeys. So this is because of a condition called as the Kumphase paralysis. The site of injury here is the lower trunk. In case of the Erb's paralysis, it will be the upper trunk. In case of the Kumphase paralysis, it is the lower trunk which is injured. And this is usually happens when the person is falling from height, and he tries to grab something and clutches that branch of a tree or anything like that, and sudden undue pressure on the brachial plexus leads to this condition. Sometimes even due to abnormal and excessive undue abduction of the arm also lead to this condition called as the Kumphase paralysis. The nerve roots involved are mainly the T1 as well as the partly C8. So it is in the lower trunk. Lower trunk is formed by the C8 and T1. So it is mainly the T1 as well as partly C8 which are involved. The muscles which are paralyzed are the intrinsic muscles of the hand, okay, as well as the ulnar flexors of the wrist as well as the fingers. So the main nerve which will be supplying the hand will be the ulnar nerve, and that injury to this ulnar nerve leads to this condition called as the flex the especially this condition called as the claw hand, which is because of the injury to the flexors of the wrist as well as the fingers. So there will be flexion at the distal as well as the middle interphalangeal joints, and the extension at the proximal phalangeal joints. So this is called as the claw hand. The third condition is injury to the nerve to serratus anterior, which is also called as the nerve of Bell. So this is the long nerve which is coming from the root. We have already seen how it takes origin. So it will be coming from the roots directly, C5, C6, C7, and this will be supplying a muscle here called as the serratus anterior. This muscle is called as the muscle of Bell, because it helps in the pulling of the bell in case of large bells in case of the churches. And the nerve supplying this will be the nerve to bell, or it is also called as the nerve to serratus anterior. If this nerve is injured, that leads to a condition called as winging of the scapula. So if you can see here, so here this is the normal side where the scapula is in the normal position, and here in this, because of the serratus anterior, which is mainly inside, taking origin from here, it will be mainly here, which will be the action of this muscle. So when this muscle is paralyzed, you can see the medial border of the scapula very prominently. It is very prominent here. This usually happens because of carrying heavy loads on the shoulder, that leads to injury to the nerve to serratus anterior, because the origin of this nerve is in the neck. So if you're carrying heavy loads on the shoulder, at that time it can lead to injury to the nerve. The disability is you cannot push and punch. Especially if you want to examine this patient, ask the person to push the wall. Try to ask him to push the wall. When he tries to push the wall, at that time this medial border is very prominently seen and it starts moving. This is called as winging of the scapula. So that's why this is called as the deformity of the winging of the scapula, and this is because of the injury to the nerve to serratus anterior or the nerve of Bell. The fourth condition is called as the medial cord injury. This is mainly because of the injury to the ulnar nerve, and this condition is called as the ulnar claw hand. If you can see here, this is the two digits, the medial digits have been the fourth and the fifth digit, fourth and fifth finger, that is the ring finger as well as the little finger. You can see them, and that they are actually showing flexion at the middle as well as the distal interphalangeal joints. So this is called as the ulnar claw hand. Here also you can see the second position from the back. You can see here when all these digits, or the three digits, are normal, but these two digits you can see in the clawing of the hand. And the fifth condition is called as the lateral cord injury. So these are some of the conditions which are mainly important in case of the injury to the brachial plexus. This is a complex version of the same brachial plexus. If you can try to understand, all these are the different roots, and here you can see the trunks, and here are the divisions, and here are the cords, the lateral cord, medial cord, as well as the posterior cord. And here this is the simple version where the nerves have been shown how they are coming from the neck and they are entering into the axilla, and from there into the upper limb. So these are the pictures which are showing all these different parts of the brachial plexus. So this is all about the brachial plexus, and these are the references for you. And if you have any doubts regarding this, you can definitely write to me, and I will try to answer. So thank you very much.